My mom, from many years, she was feeling this joint pain. So this could be due to her lifestyle or due to her increased body weight. So when I was telling her about the knee replacement surgery, she was not ready mentally, and she was saying that I don't want to do the surgery because many people have done these operations in different countries and it didn't work, and now their legs or their knee joints are fused or fixed. So she was not ready.
So she was basically suffering from bilateral osteoarthritis, both knees, with varus deformity.
And later on, like 2-3 years ago, when the osteoarthritis or the problem was increased, so doctors told us that she needs only medications. She's not in stage to do knee replacement.
We tried to convince the patient for the surgery because she was very apprehensive of getting both the knees operated at the same time, plus she was also apprehensive about the surgical part.
And during surgery we faced a lot of difficulties. There was on the inner side of knee there was tissue contracture, and posterior side also joint capsule was contracted. During surgery we had a very balanced approach while releasing the soft tissues, and we did extensive release, and we were very meticulous during our bony cuts, and ultimately we achieved our target.
The day Bibi Taiba was operated, she was kept in the ICU for 1 day, and later she was shifted to the ward. She was made to walk on the day 2 after surgery.
And every day the doctor is coming for physiotherapy, and the recovery is very good, and she is now she is able to walk, and she's better now.